Hello and welcome. Today, we're diving into a complex and often overlooked condition: metastatic orbital tumors. These are cancers that originate elsewhere in the body and spread to the bony socket surrounding the eye, the orbit. Understanding these tumors, their origins, and how they impact vision is crucial for effective diagnosis and management. So, what causes cancer cells to take up residence in the orbit? The etiology of metastatic orbital tumors involves cancer cells detaching from a primary tumor site, such as the breast, lung, prostate, or kidney, and traveling through the bloodstream or lymphatic system. These cells then find a suitable environment in the orbit to implant and grow, forming a secondary tumor. The likelihood of metastasis depends on various factors, including the type and stage of the primary cancer, as well as individual biological predispositions. Let's explore the pathophysiology behind these tumors. Once metastatic cancer cells arrive in the orbit, they begin to proliferate and disrupt the normal tissues. This growth can compress the optic nerve, extraocular muscles, and other vital structures within the orbit. This compression leads to a variety of symptoms, ranging from double vision and eye pain to vision loss. The tumors can also invade the bone of the orbit itself, causing further destruction and dysfunction. Now, regarding epidemiology, metastatic orbital tumors are relatively rare compared to primary orbital tumors. They typically occur in adults, often those with a known history of cancer. The prevalence of metastatic orbital disease varies based on the incidence of specific primary cancers within a population. For example, breast cancer in women and lung cancer in men are frequent primary sites that can lead to orbital metastasis. Recognizing the signs and symptoms is key for early detection. The most common symptoms include proptosis, which is bulging of the eye, diplopia or double vision, pain or pressure around the eye, vision loss or blurring, and a palpable mass in the orbit. These symptoms can develop rapidly and should be promptly evaluated by a medical professional, especially if there's a history of cancer. Diagnosis of metastatic orbital tumors typically involves a comprehensive ophthalmic examination, including visual acuity testing, assessment of eye movements, and a dilated fundus exam. Neuroimaging, such as CT scans or MRI, are crucial to visualize the tumor size, location, and extent of involvement within the orbit. A biopsy of the orbital mass is often necessary to confirm the diagnosis and determine the specific type of cancer cells present, guiding treatment decisions. While there aren't distinct types of metastatic orbital tumors in the traditional sense, they are generally classified based on the primary cancer from which they originated. For example, a metastatic breast carcinoma in the orbit is classified as such, as opposed to a general type of orbital tumor. This classification is vital because the treatment approach will largely depend on the nature of the primary cancer. Treatment and management of metastatic orbital tumors are complex and often multidisciplinary. The primary goal is to control the tumor, alleviate symptoms, and preserve vision whenever possible. Treatment options may include systemic chemotherapy or hormonal therapy to target the primary cancer and any other metastatic sites. Local treatments like radiation therapy can be used to shrink the orbital tumor. In some cases, surgical removal of the tumor may be considered, although this can be challenging due to the sensitive structures within the orbit. Palliative care is essential to manage pain and improve the patient's quality of life. Unfortunately, there are no specific preventative measures for metastatic orbital tumors beyond reducing the risk of developing primary cancers through healthy lifestyle choices, such as avoiding smoking, maintaining a healthy weight, and following recommended screening guidelines. Early detection and treatment of primary cancers are crucial in minimizing the risk of metastasis to any site, including the orbit. The prognosis for patients with metastatic orbital tumors varies significantly depending on the type and stage of the primary cancer, the extent of metastasis, and the patient's overall health. While the presence of metastatic disease generally indicates a more advanced stage of cancer, advancements in cancer treatments are continually improving outcomes. Current research focuses on developing targeted therapies that can specifically attack cancer cells in the orbit while sparing healthy tissues, and on improving imaging techniques for earlier detection. This ongoing research offers hope for better management and outcomes for patients facing this challenging condition.